So the bad day was, I couldn't walk up and down the stairs. I couldn't shower. I couldn't tolerate any kind of sound. So we didn't have any sound in our house. I couldn't even tolerate people talking beside me. My kids didn't understand what was happening. My husband didn't know what was happening.
Buspar or Buspirone is a widely prescribed medication for anxiety, and it's often considered to be much safer than alternatives like benzodiazepines, drugs like Xanax and Klonopin. However, what many don't know is that in rare cases it can cause severe neurological damage upon withdrawal, also known as protracted withdrawal injury, and this can last for years. In today's interview, we meet Jennie, who developed this condition after only 4 months on the drug. We'll explore how and why this happens, the symptoms she experiences, the profound impact on her life, and thankfully, her gradual recovery. So let's dive in and meet Jennie now. Hi, I'm Dr. Josef Witt-Doerring. It's my pleasure to welcome Jennie to the podcast. Jennie's going to be talking about a neurological injury from Buspar that we would call a protracted withdrawal injury, and how it's affected her for the last 3 years, caused significant changes in her life, including job loss. And we're going to go into all of that. So Jennie, thank you for agreeing to come on and share your story.
Thanks for having me.
Yeah. I forgot one more interesting thing about Jennie, which I love, is that she's a nurse and she spent some time working in mental health as well. And so she brings that perspective into this also. So, Jennie, what happened to you with Buspar? Tell us that story.
Yeah. So, I was initially prescribed Buspar in March of 2021.
Oh, I'll cut you off. For those of you who are not familiar with the name Buspar, it's also called Buspirone, and it's an anxiety medication.
So I was originally prescribed it in March 2021. I had just gone back to work. I had been off work for a couple of years and I went back during COVID. So there was a lot of stress at work. We had a lot of kind of financial stressors at home too. My husband was self-employed. So I was kind of going back to work to bring in the money, I guess. So I was prescribed Buspar. Mm-hmm. So I only took it for really about four months. And pretty quickly I started getting a lot of body numbness and, head rushing type feelings. And, I was getting sort of Raynaud's type symptoms in my hands where my fingers were going white. So I did talk to my doctor about it, and we decided that I would taper off. So she did tell me that I could just stop it, but I actually decided to taper for a couple of months. And I didn't really have a lot of issues when I was tapering, but when I was done, I ended up with a lot of burning, mostly in my head. And then I had a lot of weird things that happened in my heart. Like I was getting weird chest pains, and everything was still virtual then. So I was in consultation with my doctor, and she had wanted me to do some tests, but somewhere in there I found all of the online information about antidepressant withdrawal. So I decided to reinstate.
Before we go there,
yeah.
Just to kind of to recap, so you get put on Buspar because there's a lot of stress going on, financial stress. Did it work at all? Because you sort of mentioned that you had this body numbness and this Raynaud's, but was there any looking back on it, did it benefit you at all in the 4 months that you took it?
No.
Okay. So this 4 months, were you just kind of waiting to see if it would kick in, whether it was going to work, and you were just kind of waiting?
Yeah, I was pretty apprehensive about trying something. We kind of tapered me up quite slowly, I guess, over those months that I was on it. Yeah, it didn't work. It didn't do anything. So,
yeah. And so you come off, and so I think you may have mentioned how long was it a quick taper? Did you gradually go down? What was that like?
So from what I recall, I tapered over 2 months. I don't remember what exactly I did.
Was it okay? Was it pretty
I don't
tolerable?
recall having any issues as I tapered.
Yeah.
It was when I stopped tapering.
You step off the last dose. Walk us forward from there. What did you notice? Were you okay at first? Were you having problems immediately? Like, how did the weeks unfold from then on? Because I know you had kind of signposted that you eventually will reinstate, but tell us about that period off the drugs, what you started to notice.
It was mostly the heart stuff that was happening. I was getting a lot of kind of squeezing sensations. And then because we're hikers, like we had been out hiking, and I remember just that was exacerbating the issues that were happening in my heart. And then I started getting the burning. I remember getting it in my scalp.
Okay. Yep. Mm-hmm.
And in other parts of my body too. That's what I remember until I reinstated.
What happened when you reinstated the Buspar?
Yeah, so I reinstated just like a quarter of the smallest dose. I got full body tingling. My heart rate shot up into the 160s. I didn't know what was happening. I was really panicked and scared. I remember we called an ambulance because I didn't know what was happening. And at that point, everything just kind of got a lot worse. I mean, the ambulance came, my heart rate eventually went down. I had a prescription for Ativan, so I took an Ativan, and that seemed to help. But then all of a sudden, all of these symptoms just started happening kind of one after the other, like really extreme panic.
This is all on a quarter of a dose of Buspar,
yeah.
right?
And then I started taking Ativan. Started taking it every day because I was getting these sensations every day. And also just needing to move. I had to walk. We used to get up. I used to walk in the middle of the night when it would just come upon the sensation of just needing to get up and move.
So the teaching point here, for those of you following Jennie's story, this is classic for protracted withdrawal. So Buspar is a serotonin partial agonist, so it's hitting a serotonin receptor. And so I would consider it quite close to an SSRI type medication like Prozac, Lexapro. And it does, because that drug blocks serotonin reuptake, the serotonin hits the receptors, and that's kind of what Jennie's drug is doing right now. It's hitting the serotonin receptors. And so what we find is that when people, for reasons we don't understand, when they taper off them, sometimes they taper too quickly, and it damages their nervous system. And so that's what Jennie was likely experiencing when she had come off the medication, and she started to feel paresthesias, sensory abnormalities on her face, this kind of tingling, but also something called autonomic dysfunction. And so a lot of people who develop protracted withdrawal injuries, they complain about rapid heart rate. So their heart will kind of beat and beat and beat, sometimes out of the blue, even without anxiety. And it's very worrying. People will go into the emergency room several times because they think they're having a heart attack. And on top of that, people will have a lot of anxiety and such. And so we have this history where you come off this medication and then you've got this sensitized nervous system. I mean, you're already having symptoms. And then you go and you reinstate a small fraction of a drug that you had previously tolerated at a much higher dose. And this is really classic for these withdrawal injuries. After you've sensitized your nervous system with a withdrawal, when you take it again, you have a paradoxical reaction. Some people will call it kindling, but essentially it is not the same nervous system that is now having the drug reintroduced to it. And so that's why when Jennie took the medication again, she had an intensification of all of her symptoms, that it went up to a whole nother level because her nervous system's now reacting to it really strongly. And so let's talk now, Jennie, a little bit about how the benzos started. So you'd reinstated the Buspar. Walk me through the thinking between you and the doc at the time. I mean, obviously you don't really, looking back, it's kind of hard to know. Like, you didn't really know what was going on at the time. How did you end up on Klonopin? Was it Klonopin or was it a different benzo?
It was Klonopin.
Yeah. Tell us about that.
So I only reinstated that one dose, and then I started
taking it, right? Or did you just take it once and then stop?
The Buspar?
Yeah.
Only the one time.
Okay, so you took it one time. Okay. Yep.
For the one day. Yeah.
Mm-hmm.
And then I started taking Ativan, but like I said, like everything was still virtual. So it wasn't even virtual video. I was just talking on the phone with my doctor. So I believe that we chatted after I had already taken Ativan for a couple weeks. And at that point, I had been online on the online forums, and, they were recommending I should, switch to a longer acting. So, I talked to my doctor about it. I told her I was on the online forums, and she gave me the prescription to switch me over to clonazepam.
And was this
the whole time that was happening?
You had like anxiety now? Because I know you'd mentioned that you had a heart stuff and you had the tingling on your face. What was the Klonopin meant to be targeting?
Well, in my mind, it was, I felt like I was in an excited state. So to me, it made sense that I would be taking the Ativan to calm everything down. But I don't really know what happened. Like people talk about paradoxical reactions. Did I have one? I don't know. I just know the Ativan wasn't helping. And then at that point, I'd been on it for 3 weeks. So I knew I needed to taper off of it. And so many things were happening at one time. I'm needing to walk in the middle of the night because I'm pacing in my house. There wasn't really a lot of time to think, what's really happening here? And
that's really common because
yeah,
when people develop these withdrawal injuries, a really common symptom that people will develop is severe anxiety, and that doesn't even do it justice. It's kind of this pervasive. Yeah, it's just there all the time, and
it's not even something that you can control. Yeah.
Yeah. It's like, people say they're losing their mind when they have it because it feels so out of control.
Yeah.
And I know, Jennie, that you had it really bad because sometimes that state of intense anxiety is accompanied by something called akathisia, which is when you have that really intense kind of lose your mind anxiety, and it's accompanied by pacing. It's probably one of the more severe presentations that we see with a protracted injury. And it's practically the worst thing that could ever possibly happen to someone. It's a maddening experience. And so what I'm hearing when you're sharing this is that things are building. Okay, so you take that dose of the Buspar, symptoms are intensifying. You've now exposed yourself to a new drug. It's unsure, like whether is it the withdrawal injury kind of just growing, which it does sometimes in a delayed way, or have you hurt yourself again with a benzo? It sounds like a lot of that is unclear. It's just intensifying as it's going. So let's go there now. So things have really kind of peaked. You're having a lot of these symptoms. You find yourself, 3 weeks on a benzo. Walk us forward from there. What happened next to you?
At that point, because everything was really intense, I did present to emergency. because in my mind, I thought I needed to find a psychiatrist that could help me figure out what was happening. I mean, that's like my 20 years of nursing, right?
What did you think was happening? Like, I know
I
you were in
didn't
like,
know. I mean, at that point,
Yeah.
I knew
Yeah.
it was medication related. My
Okay.
doctor didn't think it was, but I went to emergency and I told them what was happening and that I thought I needed to switch to a long acting to taper off. So she wrote me a prescription for 7 days. And I followed up with my doctor because everything I was reading online was saying, no, you need to taper over way longer than that. So I spoke to my doctor and I said, look, this is what's happening. This is what I think is happening. I think I need to taper. And in the meantime, emergency had set me up with a psychiatrist. So there was a waiting period where I had to wait to see the psychiatrist. So in that time frame, I was talking with my pharmacist. I was talking with my doctor. Somehow I ended up on a dose of clonazepam that was not equivalent to what I was taking in Ativan. I mean, it was more than 50% below what I guess I should have been taking. And then I guess I had the meeting with the psychiatrist, and essentially we started to taper immediately. So, I mean, I had a 2-week period where in that time frame between switching to Ativan and switching to clonazepam, where I almost felt normal. I thought I was improving. And then I got hit with way more symptoms. And that was just where it kind of downward spiraled for the next 18 months as I tapered. So It was just one symptom after another.
Mm-hmm. And now this may not have been happening in your case, but this little brief window without symptoms is, I mean, what we call them are windows. And oftentimes, after you have one of these drug injuries, you'll have these brief periods where you feel better. Some people are lucky enough to feel normal during them. And then they kind of go. And sometimes they can go for a while. Like you'll have 2 days where you feel fine, but then you might feel bad for 2 months after that, especially at the beginning. But then slowly, more and more, as your nervous system is able to regulate itself, you start to have more of those windows, and that tends to be a sign of healing. And so that can be really confusing to people, to feel very sick and then feel well and then feel very sick again. You know, they often think that they've done something to make themselves sick again, but they haven't. It's just the course of the condition. Before we move on into what happened during your taper, I want you to help us step into what a bad day felt like for you back then. When things were at its peak, just to sort of give the listeners some texture as to what it's like to have one of these neurological injuries. Talk us through a bad day for you.
A bad day. Well, I have 2 kids. So they are 10 and 12 at the time. So, sorry.
It's okay, Jennie. I'm sorry. Yeah.
So the bad day was, I couldn't walk up and down the stairs. I couldn't shower. I couldn't tolerate any kind of sound. So we didn't have any sound in our house. I couldn't even tolerate people talking beside me. My kids didn't understand what was happening. My husband didn't know what was happening. It was really devastating. It was really devastating. And in my mind, I just kept thinking it's going to get better. I really just listened to what everybody was saying online. It gets better. And, I mean, it did get better, but it was like that for a long time. So I had a lot of pain, and yeah, the bad days were really bad. They were really bad.
What was your headspace like? Because if you couldn't walk up the stairs, was that because you had neuropathy in your feet, or was it because you were weak?
No, I had such really bad pressure in my chest, that my heart rate went up so high. Like the pressure was so intense. Like I would crawl up the stairs. I talked to the psychiatrist about it. I told her, like, I can't walk down the street without getting chest pressure. And she didn't even bat an eye. She just said, oh, she's like, that sounds like anxiety. That sounds psychosomatic. And I was just like, no, that's not what it is. And that was sort of the point where I knew that it was like, I was on my own.
Tell us about the headspace when you have one of these protracted withdrawal injuries. I do talk to a lot of people, and it's quite a kind of a maddening place to be, with all of the anxiety. Are you able to provide some texture as to what it was like emotionally for you on one of these bad days?
Emotionally, I guess I felt a lot of guilt as a parent. I felt a lot of shame because I didn't know.
When you say you didn't know, like you expected that you should have known better than to take the meds, or what did you mean by that?
Yeah, I guess. I guess anger,
Okay.
just sort of this feeling that these medications are supposed to be safe. That's what I learned. Just mad at myself for taking them, right?
Yeah.
Like everybody. I'm sure everybody feels that way. Yeah.
They do. It's really interesting. They do, but it's not their fault and it's not your fault because you go and talk to professionals and they tell you what to do, and people have always told you, go and talk to the doctor if you're having a problem, and you have this trust. And I'm gonna stick a pin in that one now, because later on I'm going to ask you how this has changed your perspective on medicine as a nurse.
Yeah.
But before we go there, what's the journey been like for you? So this happened in 2020. You started to taper. Give us the bird's eye view of what happened to you from then up until now, recovering from this neurological injury.
Well, for the first while, I want to say the first kind of 6 to 9 months, or 6 months probably, I think I was kind of in a lot of denial that this was actually what was happening. In between, like I believe it some days, and then I'm like, no, this can't be what's happening to me. Like I just, and then it's just been like a grieving process, really. It's been 3 years since that initial, injury, and I think I'm just going through that grieving process. Sometimes I'm angry, less so now these days, and a lot of times just really just days where it's just really hard when you think about everything you've lost. My kids are 12 and 14 now, but like we're super active. We hike, we ski, we backcountry camp. I can't do any of that right now. My nerves, like I just get lots of pressure. So managing that's really difficult because obviously I want to do all of those things. It's hard. but you know, like I want to say too, though, that where I am now compared to where I was, you know, it's like it's night and day. I mean, I do mostly everything. It's like a slow rebuild, right? Like I lost all my muscle mass, so it's like, okay, now I'm starting to walk again. It's just all of these little things that you have to start slowly doing, and your nervous system, you know, gets angry at you. So it's like all of these little things that you have to push yourself to do. And there's a lot of fear, right? You know, am I going to make things worse again? You know, some of that is slowly starting to fade. But it's a long process. Yeah.
I mean, it's ironic's not the right word. I'm going to say cruel twist of fate, that you got on these medications for financial stress, and so I want to ask, how did this affect your ability to work, and financially provide for your family after this happened?
I couldn't work. My symptoms were too bad. Like I had really bad nerve pain. Like it was quite bad. Like I went back to emergency, and I mean, they of course wanted to put you on other medications. So I actually did try. I didn't want to try anything else, but the pain was so bad. Like I used to get it in my teeth and my ears, and so I did try Lyrica for, you know, about 4 weeks, but I just ultimately I didn't want to take anything. So, sorry, what was your question? I just sidetracked there.
No, you were providing a list of disabling symptoms that made you unable to work.
Yeah, no. There's no way I could have worked. I don't even know how to describe it. It was just like, the pressure that I used to feel in my chest, and then it moved like to different parts of my body, like my abdomen, everywhere, my head, my jaw. Like it took me a long time to just be able to walk down the street again. I did have to let go of both of my jobs at the time. I mean, I didn't even know how to tell them. I didn't even know what was happening.
How long was it until you were able to return to work, from resigning?
So where I felt like I could probably, I haven't gone back to hospital nursing, but where I felt like I was, you know, could work part-time again was probably, I want to say probably like a year ago.
So it sounds like you were sick for, I guess, 2.5 to 3 years, like quite disabled from this.
Probably disabled for probably about 9 months. And then I started to get more of the waves and windows kind of pattern.
Mm-hmm.
Yeah.
And so what Jenny's talking about, it sounds like she started having more and more periods with lower symptoms, which is signifying that she's getting better. And that's and that is a pattern for a lot of people with these injuries. Not everyone, but in a lot of them, that's how we know that the recovery is happening. Another thing I want to mention, you know, I talk to a lot of people with these drug injuries, and maybe this is something that people could kind of pop in the comments. This is an observation. I often think that benzo injuries and antidepressant injuries are quite similar, but I am noticing that people with antidepressant injuries, especially from like the serotonergic drugs like Lexapro and such, they complain, they have a lot of facial paresthesias. And so I do hear people talking about their teeth feeling funny, about tingling on their head and their face and their neck. And I think that's interesting. So, I mean, if that has been your experience with these protracted injuries, drop it in the comments. If you had a benzo injury and you had facial tingling, let me know in the comments as well. That's just something I notice that I think is interesting symptom-wise. So, Jennie, was there ever a point during this where you thought that you weren't going to get better and that everything was essentially over for you?
I did. There was a point where I didn't know if I could keep going based on what I was experiencing. That's why I wanted to try medication again, I guess, because I didn't think with the pain that I had and the not knowing that it would get better for sure, I didn't feel like I could keep going. Somehow you always find a way. My kids were definitely a huge part of what kept me going. But I feel like a lot of times I just kind of just tried to believe, like I was online a lot. So, people were getting better that had the really bad symptoms. So, and then, I guess kind of over that 9-month period when things sort of were less severe, I guess. Then I think I knew that it was getting better. Still needed a lot of reassurance though. Like my husband's been a huge supporter. Just always reminding me, yes, Jennie, like look at where you are now compared to where you were. Right. So yeah, there were times where I didn't believe that I would get better, but.
How far into this injury, how long did it take after you were hurt to see the hope for yourself? And I say this because there may be a lot of people listening at the start of their injury and they know, and I try and tell people that you do reach a point where you've seen enough progress, or maybe you're able to do some things you enjoy, and then it gets a lot easier because you kind of remember what you're fighting for. So I want to ask you, Jennie, when did you cross that mark where it was easier for you to be hopeful about the future and to feel more certain in the inevitable recovery?
Yeah. So, for me, it was probably that 10 to 12 month mark when the symptoms weren't as severe. Yeah. When the pain started to come more intermittently. It took about a year. Yeah.
So, Jennie, I'm going to switch gears and I want to talk about you, how this experience has changed you as a healthcare provider. But before I do that, is there anything that I didn't ask you about with regards to your protracted withdrawal injury that you think is important to share?
No, I don't think so. Yeah.
Okay. All right. So how has this experience changed the way you've looked at the mainstream medical model that you work in?
Well, if I had to be honest, I think I've kind of always had one foot out the door. For probably most of my career in nursing, to be honest.
What do you mean by that? Yeah.
I really liked it when I first started. I started in vascular surgery. I really liked the fast pace. And then I liked it when I moved into pediatrics, still really liked it. But then I was in mental health for a couple years, and there's just a real pattern, right? Where, people come in and they get treated and they go and then they come back. It didn't make sense to me, I guess, that it didn't make sense. The model didn't make sense to me. There's no time for any kind of preventative learning or teaching for people. So, and then, at the end, it was just I just felt like I was just giving out medication all the time. And I didn't want to do that. I'd always been interested in, the body and holistic health, eating well, and all of that. So, I had started actually learning about the functional nutrition, probably a year prior to what happened. I had started going back to school for that. I guess if there's a silver lining, it's that it was sort of the nudge, the very big nudge that pushed me in the direction that I guess I always wanted to do anyway. And I mean, there's no way I could ever go back to working in the hospital after what happened. I couldn't do it. My value system just does not jive with it. So yeah. I couldn't.
So Jennie, I know you offer coaching services now. Could you just describe the types of problems that you help people with?
Yeah. So, I mean, the big ones, I guess, would be like digestive health, gut health. I mean, essentially it's like a root cause approach. So any symptoms that you would be feeling, I guess, figure out like where that imbalance is in the body. And then what you do is basically it's just helping people figure out what foods to eat for those imbalances and teaching them how to eat. So yeah, a lot of gut health, hormone health. Yeah.
Okay. And we talk a lot about that on this channel. I mean, we've had Chris Palmer and Georgia Eid on.
Yeah.
And we also recently had Rachel Brown on as well, all really into diet. And personally, I've seen it absolutely transform some patients. And so, Jennie, if people wanted to learn more about you and how you could help them, where would they go to look?
Yeah. So they could go to my website, which is www.innerwhisperswellness.ca. And I'm also on Instagram, the same handle, Inner Whispers Wellness.
Okay. And Jennie, before we end, I want to ask, do you have a message out there for someone who might be in the midst of it, maybe within the first 3 months of a protracted withdrawal injury, kind of at the peak? What would you want to share with them?
Just keep going. I mean, it just gets so much better. It really does. I mean, you just have to believe those stories that people tell you. I mean, it does. It gets better. I'm doing everything. There's a few things that I can't do. But it's so worth it. Yeah.
Okay. Well, on that note, we'll wrap. Jennie, thank you so much for agreeing to come on and share your really important story.
Thank you.
Thanks for watching the interview. If you're interested in learning everything you need to know about protracted antidepressant withdrawal, consider watching this video here. Or if you'd like to hear another engaging interview that goes into this topic, please consider watching this interview that we did with Marcello recently.